Hello, friends. I don't know if you can notice, but I'm sick. But I just wanted to make a medical tourism in Mexico because this time I had time to go to Mexico because there was a situation. I'm gonna tell you more about it later. But the point is was that I had time to do a vacation and I was like, medical stuff it's cheaper in Mexico, so I'm just gonna take advantage of it. So I'm gonna tell you a little bit of what I have been doing here aside from vacation. And as you can see, I'm sick. I didn't come sick, but for some reason I have been getting sick when I come back. I guess the viruses are different. But here we have a thing called Simi, that it's a walking clinic that usually it charges like $2, $3 per visit. And I tried to go there, but it was closed because I went during the night. Also, this medical tourism is outside Mexico City because I thought, and probably it's more expensive than other places in Mexico. So I went to Estado de Mexico because I knew it was cheaper. So then, because I was feeling sick, I went to another pharmacy. It was called Benavides. It's the same as Simi, but more expensive. And the consultation with the doctor was 50 pesos, who would be like $2 or $3, like Simi. And the thing is that the medicines are more expensive outside Simi in other clinics, but still it was cheap. I apparently have a throat infection, and she sent me several medicines, which was nice. Usually they send you the antibiotic and stuff like syrup with like plants or things. Like Mexico has a lot of natural things. And she sent me like a syrup for the throat and something for the discomfort. But in Canada, usually they never send stuff for discomfort aside from Tylenol. So I just took the antibiotic. The antibiotic was 200 pesos. That it would be like $10. So my whole medical thing, it was $13. So if you get sick with the flu or something mild like the stomach, you can go to a walking clinic and it would be cheap. I didn't bought the syrup. Well, coughing syrup, I don't know how you call it, but let's say syrup because there's several kinds of syrup. And I didn't buy it because I thought my mom would have some, and she did actually. So this is the one that has a lot of natural stuff. In Canada, I sometimes use something called sambuco that has elderberry. But I guess every country have different plants. So here they use eucalyptus and comifora. And yeah, it's like, this is something natural, so I guess it's not a problem if you take it. I don't want to talk about the antibiotics that I got, but I wanted to show you that, yeah, Mexico has a lot of natural stuff for the discomfort if you get sick. That's good, because I feel sometimes Canada doesn't have enough. Also, fun fact, Mexico is already cheap, but if you go on Mondays to Simi, it's even cheaper. They have a discount, so if you get sick on Monday, then it's more convenient. By the way, in comparison, in Canada, if you don't have a health card, I think go to the walking clinic, it's from like $80 to $100, so it's very expensive. Don't get sick in Canada unless you have a health card. And the medicine, it varies because one time I got an antibiotic for $5 and another time I got one for $20. So now you know. Also, if you're getting the Canadian health card, it covers usually the walk-in clinics, like you can see the doctor for free, but antibiotics, then you pay for all your medicines. So I went to a lab to get an urinary and blood exam. It was mainly for the blood exam, but it was a package apparently, so I got both. And the blood exam, it was like a complete exam, like the basic complete exam. They had more exams with more things, and they had a basic urinary one. You need to bring your urine in a little container. They have containers if you happen not to have one. And the blood, I don't know if they were nurses or doctors, but they were very, very kind, and I really liked them. I
paid my studies with one doctor because both of them, they were doing everything. They were receptionists and doctors. And then I went to a room with one of the doctors, and she was very nice. She was distracting me while she like placed the needle in my arm, and I think she got 2 little containers of blood. I don't remember exactly, but it wasn't painful. Sometimes people get very stressed when it's blood related, but the nurse was really good, so I really like that service. The place is called Chopo, and they have several places around the city, and I guess around Mexico in general. But that was a let's say mini lab, because they have bigger labs, and they said they only had some labs in there. But if you needed like an electrocardiogram or something more complex, you could go to the bigger place. But it was pretty good for something simple like that, and they sent me my results online after, I think it was 2 or 3 days, and it was, for all the package, just $50. In Canada I have never got a blood exam or any kind of exam aside from the radiology test. I have heard if you talk with your doctor, family doctor, or in a walk-in clinic, and you let them know that you really want a blood exam or some kind of test around the year so you know you're fine, they can refer you, and then it will be free with your health card. But I also know some friends went to get one just to know they were healthy, and I think for them it was, the minimum one was $50. I think there are more expensive ones, but price-wise, so far in my knowledge, they would be similar between Mexico and Canada. But I don't know if in Canada they send you to your mail. So in terms of convenience, I like the Mexican one. The other thing I got was glasses. I have them around there. And that was 375 pesos. I went there, and the optometrist, you don't need an appointment or anything. I just got there to the Devlin clinic, and he checked my eyes with for me it was a simple exam, but he had like several machines, and it took like 15 minutes, and he got my results like the same moment, and he told me I needed glasses, so I paid, and I picked them up 5 days later. And it was pretty easy. I really liked the service. It was very professional. Now the good part of why I decided to do medical tourism in Mexico. Everything started because I had a UTI, and first I don't want to spend my whole afternoon in the doctor, because the last time I went there without appointment it was 3 hours. So if I made an appointment, then it would be the next day, because usually they are full. So I opted to go to the Shoppers Drug Mart. If they have a pharmacist, he can check you up. And I went there, and he gave me medicine that was $20. And it was a mild antibiotic, it wasn't a hard one. And I took that, but I was still feeling sick. So I went to the other doctor, and I had to make the appointment. The appointment itself was free because I have a health card, but I went there, it took me like 1 hour of my day because I made the appointment, and he gave me another medicine. It was an antibiotic, but it was harder than the other one, or at least more strong, so that one was like $25. And then I took the medicine, and I then felt better. Well, I felt better, but I was still sick. So I went back. He was, if you're still sick, like I was like in a pain from 2 to 10. It wasn't that bad, but I was like, something's weird. So I went back to his office, and he was like, you need a radiologist to make you a pelvic exam. And I was like, I'm gonna die, because I thought like he would say like, oh, just change the medicine or anything, but he said like, he made me an exam, I don't have any UTI or anything else, because at least that was cured. but I still had pelvic pain. So he told me to go to a radiologist, and I was very stressed because I made the appointment, and the appointment was 4 days after that. But I was very stressed all the time. I was like, what if I have cancer and I'm gonna die? So 4 days I was very, very stressed, and I went to the radiologist. That took me like 3 hours of my day. Like, the place itself was very professional, but it was all very white and medical, and that didn't help my stress. So I went with the doctor. The doctor, she was really nice. She was also very professional, but I don't know, it looked very clinical and medical, so I was very stressed, and I was like, I'm going to die. And I asked her after all the exam, like, do I have anything? And she was like, I can't tell you anything. So she sent the results to my doctor's office, and I needed to wait another, it was 3 to 5 days, something like that, but I waited 5, and they got it 6 days after. All this time I was very stressed, feeling I was going to die. It was very strange because I was like, one day I was like normal doing my regular stuff, and then I was like waiting for a radiologist study because I had a weird pain in myself. So I waited, and this is like the fast version, like every day I was like, I'm gonna die. So I was thinking like, what would I do if I were actually going to die, and those weird dark thoughts you could get. Because also all my family is sick with something, like kind of mild, medium to mild, but I also have friends with cancer, so that didn't help. I was like thinking the worst case scenario. And about the radiology exam, it was free with the health card because my doctor asked me to get one, but you need your doctor to ask you to get one. If not, it's like $500 without the referral. So then I went to the doctor, and he told me I have a cyst, but I shouldn't take it out. Like, I don't need an operation, which is good because I am very scared of operation. I would think I'm gonna die again. The consultation, it was pretty quick because the first doctor that checked me up for the UTI was not the same doctor I saw at the end, and of course it wasn't the same as the radiologist. So I was like, okay, what should I do, or what did I get it? And he was pretty quick, and he wasn't rude or anything, but he was like, you're fine, you don't need to do anything, you can go. But I was like, I have questions, and I thought I was going to die for like 2 weeks. So like, he didn't answer all my questions. He just was like, oh, you're fine, like, leave. So just to make sure, because I already had this vacation planned, I went to Mexico like for my mom's birthday, and I was like, okay, I'm gonna see all the doctors this time. So to have a second opinion, I made an appointment at the gynecology center. It's a private place, it's very small, but I like that the receptionist is a nurse, so she can answer questions, and she's very kind. She usually helps you when you're in the doctor's office and stuff. And also I like that the place is purple and pink, so you don't feel that overwhelmed with medical stuff. I feel that helps. And I went there to ask. They have several packages, but they told me I should just get the radiology exam. It wasn't as, let's say, professional as Canada, because Canada has more machines, but I feel like in ability they were more professional because she told me I would get the radiology exam and then the gynecologist consultation the same day, the same hour. She told me that would be $20 around. So I went there, and the radiologist indeed took my exam, and I like that. Like in the other place here, they have like a screen, but instead of just taking the pictures and not saying anything, he was like moving the camera around, and he was explaining me everything he was seeing at the same time, like it was live. So that was very helpful and I was telling him like, oh, I have this pain and this sensation. So he told me I do have a cyst, but I shouldn't worry and I shouldn't have an operation, so that's good. I like that opinion. And then he made some like notes and pictures, and he sent them to the gynecologist that was just like one floor downstairs. So it was like in 10 minutes. I didn't wait at anything. And then she told me it's likely because I take the contraceptive injection, the Depo-Provera, and I like it because I don't have any symptoms. I don't even have a period, so I feel like, I don't know, I feel like I have the same mood and stability all months. That's why I like it. But she told me it was a very harsh injection, so maybe that's why I have cysts. But 6 years ago, before using like any hormones, I already had cysts. That's why I met that clinic, and they told me like it could be hormonal or normal, but it's not a big deal because I just have a cyst like 2 centimeters, and she told me that's like, I can live with that, and that happens to a lot of women. And I told her I wanted to get I think it's the hysterectomy, I don't know, that operation that makes you not have kids, but my other doctor advised me to use the injection, and then she advised me to use the implant. Yeah, I have never used the implant, but of course I'm scared because I have very low pain tolerance. So I told her, and she said I could do it here in Mexico, and I trust them more because I cry, and I feel they are better containing people. Like if you cry, they are like, calm yourself. But in Canada it's like, okay, you can go, like you go home crying. So I made an appointment for that. And going back to the cyst, she said I need to take like 4 different pills. One was for my intestine because I have been eating out and I'm bloated. So I guess that was optional, but she said I would feel better with that pill. And then I got 1 pill for the cyst, or 2, and I got probiotics, I think. So I like that in Mexico they give you more medicines, more for the symptoms. So also I understood like the Canadian doctor said the cyst would reabsorb, but here in Mexico it's like, okay, we're gonna do something. Like maybe it's mild, but I feel better that we are doing something and it's gonna cure it faster. And my 4 boxes of pills, different pills, it was like $50. That one wasn't that cheap, but with the radiology exam it was $70. So I believe like for like the consultation with the gynecologist, the radiology exam and the pills, $70, it was very reasonable. Maybe I made a mistake and it was like 100, like I think it was 70, but I don't have the receipt. But I feel like for all the consultation in the same hour, even 100 would be worth it, because in Canada just the radiology exam is $500. It's very practical because let's say you work in this season that it's Christmas and you have like a lot of work, let's say for an example, and then you need to work like 5 to 6 days a week, then you make an appointment one day and in 2 hours max they tell you what's wrong with you, you go home with the pills and then you live your life. Instead in Canada it's nice that the healthcare covers some stuff, but then you are 2 weeks very stressed because you think you have like something very strange and deadly, so that doesn't help mentally. And maybe that's something very not professional, but I like that the doctor's office is purple and pink. It doesn't feel so, I don't know, when everything is so white, it looks clean, but you feel you're in a hospital and the situation is bad, so that doesn't help. Next week I'm gonna get the implant. Probably I'm gonna cry and yeah, and like cry because it's not something very hard, but I am very, like, I'm a crybaby. So I'm gonna get that next week and I'm gonna tell you what happened. But yeah, in Canada I spent, let's say, around $40 to $50 in all the antibiotics, but it was like a 2 to 3 weeks wait. And in Mexico it was like $100, but I had everything done in 2 hours. So in my opinion, in this case, I feel I prefer Mexican services. I went to the dentist and my mom made a mistake and she booked me for a whitening. I don't remember how much it is, but it's not that expensive. And I actually wanted a cleaning. I think you should do once a year. So I told the doctor I just wanted something different and she was okay with it. And something fun about Mexico is that it's very child friendly. It's not a child doctor, but my mom likes her because she's very nice. And we went to her place. I'm gonna show you which place if you want to try it ever. And it's interesting that here in Mexico a lot of things are kids friendly because the doctor's place had a mini place for kids with a lot of toys, and even if they wanted to color something they could paste it at the doctor's place. Like she had a wall just for drawings. That was cute, and I feel that helps not to feel so stressed. And also I like that her office was all blue with little mouses stickers. It was very pretty, and she had a Hello Kitty robe, or that kind of clothes they use, the special medical stuff they use for clothes. It was Hello Kitty and it was very pretty. And the whitening was very fast. I don't know, it was like half an hour and it was not painful at all. And she had music playing. It was a nice experience and it was only $50. In Canada, usually they are more, let's say, serious. Like the consultory I have been, it's all white and they don't talk with you that much. They just clean your teeth. So it's a different experience, but in Canada it's so much more expensive. It's like very, very expensive. Here in Mexico, if you happen to be here, I don't know, in Cancun or Cozumel or anywhere, if you have half an hour, go to the dentist. It's very cheap and it's good. Also, the only indication she gave me was not to eat anything for 40 minutes. She said after I could have coffee and anything else. So yeah, if you have time on your vacation, you could do it. It's very simple and cheap. Just maybe make the appointment one day before to make sure he has the time you want. But aside from that, it was very efficient. Today I got the implant in this arm and I would do it again in Mexico because I like that. I don't know, at least in the private sector, in my experience, doctors are very kind, and I went there and I was with the gynecologist and her nurse is the receptionist too. So also while you're waiting you can ask questions to the receptionist, who is the nurse, because she knows what she's talking about. So I was there and I waited half an hour even with the appointment, because sometimes that happens, and I was very, very, very stressed, and I got a coffee before because that was my price. And I was waiting and then I entered and I was like, I'm very scared, and I was very stressed because I have a very low pain tolerance. They were very nice and very kind, and they were like, relax, it's fine. And in my experience, at least in Canada, doctors are very professional, but they don't really care if you're crying. I wasn't crying, but I was almost crying. So I was in the bed they had for patients, and the nurse was very nice. I was fine, but she was very helpful, like helping me like lay and also standing, like if I were gonna pass. I was not going to pass, but I guess that happened before, so they wanted to make sure. So I was there and the doctor gave me some anesthesia. She gave me anesthesia 2 times because she gave me anesthesia and then she tried, I guess, with the needle. I don't know, I was all the appointment with my eyes closed, and then she was like, are you in pain? Like she tried, like tapped, or I don't know what she did, but I feel something in my arm, and I was like, yes. So she gave me more anesthesia, and then I was fine, and then she showed me the box with the implant, so I knew it was new, and I was like, okay, I don't want to see. So she gave me the implant, and I didn't feel pain after the 2 anesthesias. And then I was lying there for like 5 minutes. And then I standed with help with the help of the nurse. I was fine. I didn't got dizzy or anything. I was just very stressed before the procedure, and after I was fine. And they gave me a bandage. I'm gonna show you. And it's not tight. I washed my hair before the appointment, so I don't need to wash my hair like in 2 or 3 days. Because she told me I need to come back in 2 days so she sees the implant and my bandage. And in general, it was very good. And also, I told you I got the blood test in another place. And then I showed her my results, and she told me maybe my high cholesterol is genetic because I'm very healthy. That made me very angry. So she gave me medicine for 3 months, and I guess I should check again. But also, she gave me, I guess, painkillers, like mild, not like something crazy, but she gave me painkillers like ibuprofen and something else for my arm. She said it's normal if it gets purple, and I was like, okay, I'm okay with it getting purple. I'm just very like scared of pain, so I was scared of the appointment, but after I'm fine with it. So far it's not painful at all. And she also gave me, I don't know, she gave me several pills. It was one for the cholesterol, 2 mild painkillers, and something else. But the point is that they are very good. They are very ahead. So they already know if you're gonna get pain or... also she sent me something for my arm if it gets bloated, I guess. Something like that. So yeah, I really like that Mexican doctors, they send you stuff for all the symptoms after. Sometimes in Canada the most they give you is Tylenol. I guess, I don't know if in Mexico they have more variety, but I'm very pleased with the service. And it was $200. But I think the injection in Canada is like around $50 every 3 months, so it's a good way of saving money. I got a 3-year implant. I wanted a 5-year, so I need to come back to Mexico in 3 years, but that was the one she was able to get. I guess they don't have that many 5-year implants, but it was okay. But this, if you get in Mexico, I came here for a month because I had the time and I wanted to do all the doctor stuff. And yeah, I went there the first week because I have a cyst, you already know that. And this is my last week in Mexico, and I need to come back still Thursday, and I leave Sunday. So if you're gonna do gynecological stuff, in my experience so far, 1 month was the best time for it. Hello friends, this is me of the future. I'm in Canada now, and I had the implant placed some weeks ago, like a lot, but I wanted to show you like the final result. So this is how it looks now. It took several days from my last appointment with the doctor to clear out completely, like to not have any kind of bruises, but right now all I have is a dot. And if you press the arm, you would feel like a little line. It's hard to do it with just one arm, but yeah, like I feel the little stick because it's a mini stick like this size there. And I started training more often because I have a gym very close, so I started going 5 days a week. And at the beginning it was a little awkward because I could feel the little thing inside my arm, like doing this exercise, and mostly the arm exercises were a little weird at the beginning, but after a week of getting used to it, I don't really feel it at all, so it has been very good. I don't have any kind of symptoms. The only symptom that I had, it was that it could make you gain weight, and I gained like 4 pounds, but I also entered to the gym, so at this point I guess that weight is muscle, so I gained the weight and then I started the gym, and right now I'm at the same weight, but I don't feel it's fat or anything. Well, I just wanted to share that symptom, but aside from that, I don't feel anything. It's pretty nice. I feel perfectly fine, and I would recommend it, at least in my experience. After these 3 years, I have been thinking in taking it out, like when it expires, and then take like a 1-year break or to see what's best for me. I would like to get the operation because that way I wouldn't need to worry about it at all. But also, it's a big decision. I'm sure I don't want kids. It's a big decision in the sense that it's an operation, and my doctor told me it's a major thing compared with just one little thing in the arm. But I'll see what I want to do in a year. So, in general, that was my medical tourism trip to Mexico. Let me know what you think. And if you want me to talk to you about another services, like I need to get a allergic test soon, like in a week. So I'm gonna make a video about that. I'm gonna compare it with Mexico. I have not been there, but I have family there. So I also have friends there who can share with me the experience of an allergic test in Mexico if you want the comparison. So let me know what you think, and I'll see you in the next video.